If you or a loved one has noticed changes in your voice, you'll want to see a specialist to rule out the development of vocal nodes or other serious conditions. Rebecca Hill, speech-language pathologist at Lake Ear Nose, Throat, and Facial Plastic Surgery, explains how she tests and treats her patients.
A lot of times people will complain of hoarseness, vocal weakness, a decrease in pitch range or volume. They can't project their voice as they used to be able to do. Their throat might feel sore or tight. Sometimes people will say they have a lump in their throat and they're not sure what's going on, and it feels like they're having difficulty swallowing food or pills. As you age, you can have some vocal weakness. Just as all of our muscles atrophy over time, the vocal folds are actually muscles and they atrophy over time as well. So sometimes the vocal folds don't close as tightly as they did when you were younger. Each patient's therapy is individualized, and we'll work on different parameters of voice, such as pitch, resonance, airflow, and then we'll do specific exercises that may need to help strengthen a patient's vocal folds if that's the issue. We're able to better identify exactly why a patient is having a voice disorder, versus if a patient has a little lesion on their vocal folds, such as a nodule, which I think that's probably what most people are familiar with hearing as a vocal nodule, which is basically like a callus on your vocal fold. Then we can better see paralysis if one vocal fold isn't moving as well, or if there's perhaps a cyst or the development of cancer. Now, technology has provided us with an opportunity to see your voice box much clearer and sharper, and we can actually see the vocal folds oscillate. And when they oscillate, that's when a lot of times you are able to visualize lesions that you may not see when the physician is using the traditional flexible endoscope that goes through the patient's nose. The actual procedure only takes about 2 minutes.
For more information on this story, as well as links to the specialists at Lake Ear Nose, Throat, and Facial Plastic Surgery, please click on the Vocal Changes story link on our homepage at yourhometownhealth.com.